Welcome. Thank you for tuning in to It's Time for Your Health Show. I am Dr. Jeanine Cook Gerard, and today we're interviewing Ms. Joanne Gabrus. She is an assistant professor at NASA Community College in Garden City for the last 6 years, 28 years as a psychiatric nurse, and 30 years as a medical surgical nurse, 17 years as a breast cancer survivor. This is an awesome story that you don't want to miss. I am really blessed to interview her. I am a colleague of hers and have been teaching at NASA Community College for 30 years myself, and a host of Your Family's Health, 90.3 WHPC in Garden City. And we are going to really hear of the ups and downs of breast cancer and how she survived it all. So stay tuned as you're listening to this great testimonial of this person who got through it, and so can you. Hello, and welcome back to It's Time for Your Health Show. For those of you who are just joining us, my name is Dr. Jeanine Cook Gerard, and today we're going to be interviewing Joanne Gabrus, a 17-year breast cancer survivor. So, Joanne, thank you so much for joining us.
My pleasure.
So tell me about how this all began for you.
Well, I have a very strong family history of breast cancer. My mom died of breast cancer at an early age. She was in her 50s. My maternal grandmother, they're not sure, but they think it was some sort of a female cancer. And my paternal grandmother also, she had breast cancer, but she died of a heart attack. So I was followed very closely. All right, I would go for mammograms every 6 months, sonograms, an MRI once a year. And knowing my history, they really, monitored me close. I happened to find a lump myself, went running to the doctor. They did a biopsy of the lump, and it came back fat adenoma, which is a benign condition.
So tell me, just to stop you a minute, when you found the lump, was it in the shower? How did you find it?
It was in the shower. It was a little pea size, so it felt like nothing. But with the history, I felt I should have it looked at and taken care of. I had gone for, my mammogram 6 months prior, and I was just about due. Went to the doctor. He did a needle biopsy.
And a needle biopsy, just for the listening audience, what is that? What is that like?
It's really, they give you a little numbing anesthesia, local, to the area, and they stick another needle in and they pull out a little piece of tissue and they biopsy it to see if it's malignant, which means cancerous or not. So they did that. The pathology came back benign, fat adenoma.
So meaning there was no cancer at that time.
Right. So I was happy with that and went on my merry way, waiting for my next 6 months to, follow up like I normally did. With that, the lump kept getting bigger and bigger. So I called the doctor back, and he said it was 4 months at this point. Don't wait. Go get your mammogram a couple months early. When I went there, the radiologist who did the mammogram, I was well known to because I go every 6 months, she did not let me go, and she did another biopsy, which that one came back malignant, which I found out like a couple of days later. They don't tell you right away.
So we're talking about how long of a span of time between it being benign and now malignant?
2 months maybe.
Wow.
So anyway, with that started, the nightmare, as I call it, but which at this point is now just a bad memory.
So tell me, when that span of time between it being benign and malignant, do you think that it was an oversight of them seeing that it was malignant?
It's funny because a lot of people say that. They're like, how can, that happen? There's always a margin of error when it comes to doing needle biopsies, because if they don't get the exact spot where the cancerous cells are, it will come back benign. Fortunately, that being the nurse, and having knowledge, I knew enough that, this is getting larger and larger, and I should do something to investigate. So with that, called the doctor, and that's how I ended up back at the radiologist and having a second needle biopsy.
So when you were feeling this lump, was it painful at all? Did it move or?
No, it actually felt like a little pea.
Wow.
That's
as
how I
small as a
describe
pea,
it.
but hard.
It was hard, yes.
Okay. And so you suspected, being a nurse, that this may be a little bit different.
I
than
did,
what?
and unfortunately, because I have a strong history, it was always something that I was nervous about and paranoid about.
And how often, because you have the family history, did you regularly go to get mammograms or?
Every 6 months,
Every
I was
6 months.
followed, very strictly. I, went every 6 months for mammogram and sonogram, once a year for a MRI. I also had the BRCA test, which is a test to see if that you are, prone to getting breast cancer. And I came back what they call BRCA negative. So that wasn't even, something that I was overly concerned with.
So I'm really excited to hear more about this, but we're going to go to take a break right now, and we'll be back to hear more. Hello, and welcome back to It's Time for Your Health Show. If you're just joining us, welcome back. I am Dr. Jeanine Cook Gerard, and this is Joanne Gabrus. For those of you that have not met her, she is a 17-year cancer survivor. Joanne, you was telling us a little bit about you being diagnosed with breast cancer. How do you tell your family about this kind of devastating news?
Oh, well, I got the news driving in the car. My cell phone rang, and it was the radiologist, calling to give me, the news that it was malignant. So I cried the entire way home. I tried to get out of my system, and I had to explain to my husband and my 3 children. I had 3 sons, and they were young. They ranged, I'm trying to think of their ages. They were 13 to maybe 9, something like that.
Yeah.
So I, was going home, and I said, how am I going to do this? Because I don't want them to be upset. I don't want them to worry. But of course, the fact that my mom did not survive breast cancer, I felt like, I was, the same thing was going to happen to me. So I, talked to my husband, and of course he was very supportive that we'll get through this together. And, he really couldn't take any time off. And I was working at the time as a nurse in the hospital, and they didn't want me there because of, the cancer and having to eventually go on to chemotherapy. So I had to leave my job. So in a sense, I was more available for the children, but it was hard because I didn't want them to see me, going through what I was going through. But their lives, I tried to keep it as normal as possible. Took them to soccer, basketball, made sure, their friends came over, as, I would do whatever I had to do to keep their life as normal.
That's so important, to keep life as normal as you can when you get this kind of diagnosis.
Right. I didn't want them to worry. Yeah. And that was my, ironically, they were my main concern at this point. So.
Of course. And so, telling your husband and your children this, did you at that time seek any kind of community support, or whether it was just keeping the news in your household?
No, I tell everybody everything.
Okay.
I'm not one of those that keeps it secret. My colleagues at work were very supportive. Once I started to get with the chemotherapy and things like that, every other day a meal would show up at my house. Even with a bottle of wine and desserts and everything to go with it. Friends and the kids' friends' parents, everybody helped, chip in with the driving and things like that, because
I want to hear more about that, but we're going to take a short break, and you're going to tell me more about that, because I think family is so important. So we'll take a break and come back to hear more about that. Thank you, Joanne. Hello, and welcome back to It's Time for Your Health Show. My name is Dr. Jeanine Cook Gerard, and today we're interviewing Joanne Gabrus. Joanne, thank you so much for sharing your story. And you were telling us a little bit about how you broke the news to your family, which is so very important in your journey. Take me from where you were diagnosed with the breast cancer to the treatment of chemotherapy.
Okay. As I say, the treatment's worse than the disease, and what happened was my tumor was very large, so they wanted to do chemotherapy first to shrink it down before they did surgery or anything else.
How large was the tumor?
It was 7.6 centimeters, and out of my lymph nodes, 20.
So that's like a golf ball.
Yeah, it was huge. And I did have positive lymph nodes, 23 to be exact. So very extensive cancer. So they did the chemo first. And again, it was like every 2 or 3 weeks. It's funny, I don't even remember at this point, but I describe it as like getting hit by a bus. I don't know how else to describe it. Like you do it and you know what you're in for. So the first time I was like blindsided, had it done, you're exhausted, you're sick, your taste buds, nothing tastes right. You're sick to your stomach, nauseous.
So these are all the side effects of chemotherapy.
Yes.
And what is that
I
like?
had them all.
What is that like when you receive chemotherapy? Is it through your vein, through a port?
I had a port in my left upper chest wall that they put in. Actually, I did not want it because that was a surgical procedure to put it in, but they said it would make my life easier, which in fact it did because I didn't have to get stuck constantly. Right. To have chemo.
So they would just access that port
Correct.
to give the chemotherapy.
Yes.
Okay.
So, I went through the treatment. I'd come home. I'd still have kids. My husband worked evenings, so it was tough. But, some days I couldn't get off that couch. I'd say, guys, just make yourselves peanut butter and jelly sandwich or something. I just didn't feel up to it. But, chemo's cumulative, so I just got more fatigued, and then the hair started to go. I started to lose my hair, and that's when I got nervous with the boys.
That is, I think, one of the for women, I would say, probably even for men, it's one of those really hard things to lose your hair.
And especially having 3 sons, and they don't understand really what's going on, and I didn't want them to see me with no hair, right. So I went out and had them shave my head and got a wig right away, so everyone would get used to how I looked in the household.
So that was an event to just shave your hair.
Oh yeah, that was a big event.
Tell me about that. What happened with that?
It was.
How do you plan for that?
You don't plan for it. There's no, you know what I mean? There's no planning you could do to, make that any better. Yeah. It was horrible. I've always had this long, thick, head of hair, and to go, day by day, it was just coming out in clumps. That is, it was tough. Yeah. But again, as I look back, it's all just a bad memory. And I guess I was fortunate that the kids were kind of into their own, routines and everything that, they didn't see me like all the time. They were busy with their friends and they were in school all day long. So, so I went through the chemotherapy.
How long was that?
Chemo?
Yeah. How long did that take to go through chemo?
It was...
Because it's in cycles, is it not?
Right, okay. Right. I want to say it was like 6 months. Wow. And then we tried to make it like enjoyable, if you can say that. We'd go out to breakfast afterwards, just to make it like a nice day. My husband always took me, so I never had to go alone. You do make some nice friends in the chemo room. We became like a nice little group. We were there, together, and
during the chemo sessions you would have a group.
We would bond, and we would talk about our side effects and who's got this, who's got that. I've had developed neuropathy, which is like nerve damage to my feet mostly. You can get it really hands and feet, something diabetics get also, which is it's very uncomfortable. Another side effect of the chemotherapy. I also now, after the fact, have liver disease. The chemo drugs do a lot of harm to different organs in your body. That's why I say the cure is worse than the disease sometimes. So
I want to hear more about that, the liver issues, and some of the impact that had on your body. We need to take a quick break and come back to hear a little bit more about that. Hi, and welcome back to It's Time for Your Health. My name is Dr. Jeanine Cook Gerard, and I'm interviewing Joanne Gabrus, a 17-year breast cancer survivor want to honor to talk to you, Joanne. And you were mentioning a little bit about the side effects of chemotherapy. Tell me more about that.
As I said earlier, sometimes the cure is worse than disease. And I did mention the neuropathy, which is like a numbness and feeling. You can get it in your hands and feet. I have it in my feet. But it feels like, people always say, what does that feel like? I say it's like walking on the gravel, barefoot.
Wow.
And then sometimes, like at night, you'll get like it feels like a bee sting, a sting or something, and burning. Yeah, it's, crazy, uncomfortable feelings. Mm-hmm. But again, small price to pay to be here and have this interview today.
So also tell me about the liver. You was telling me about the side effects of the chemotherapy affecting the liver.
Right. Well, the chemo drugs go through the liver, so you're always at risk for some sort of liver damage, which unfortunately I do have some liver damage, but I'm followed strictly. I go every 6 months for tests and CAT scans on my liver. Even though the chemo was so long ago, because it's cumulative and, it stays in your body for some time. And I guess that's why you have such a good success rate,
right.
That they do monitor for that. Again, I had, that you lose taste buds. Coffee made me, sick to my stomach. I'm a big coffee drinker. I developed this addiction to unsweetened iced tea because that was about the only thing I could drink at the time. Again, and then following that whole routine with the chemo, we ended up having to do radiation, which was 6 weeks every day.
So is that together that you do the chemo and the radiation, or they're back to back?
No, chemo is done, and then you start radiation for 6 weeks. And again, think of what it does to your lifestyle, because it's every day you have to go to the radiologist. And I mean, the whole procedure there takes like 5 minutes. But again, you have to go, go lay there. And it's just, it's a reminder. But before I get to that point, after the chemo, I had the surgery, okay? All right, I had a bilateral mastectomy done because I did have extensive cancer and I didn't want to have to go through this ever again. So I said, let's just do it that way. And, I have to say the easiest part of all this was probably the surgery.
Really?
Yeah, I mean, you come out with a lot of drains. I used to joke I look like the Unabomber because I had drains all over the place. But the surgery, again, it's a surgical procedure. You have typical surgical,
Was it reconstructive kinds of?
I didn't have it at the time. I couldn't. I had, because I still had to have radiation. So
with the radiation, how does that work? I know there's a direct beam that goes to the site of
right, and
cancer.
then you have to be careful because you get burns because it's radiation, and your skin does get burned. But they check you out, they monitor you, they give you cream for your skin. You go every day. Again, it's exhausting. Like people think, oh, you just, that's the easy part because, you're not getting chemo, you're not sitting there all day. But you know what? It is exhausting. I could have fallen asleep at a red light at the time. But again.
So at this time, while you're doing the radiation, are you still feeling the effects of the chemotherapy, or is that something that's a thing of the past?
Oh, no. It was never. You know what, I have to say, again, it was a while ago, but I always say the radiation, I had such fatigue, and radiation can cause that, but so could the chemo. And because it was cumulative, it might have been related to both. I can't be 100% sure. But
so these burns that you were talking about, they were
chest wall.
They were just to the chest wall. So did it affect you wearing clothes at that time? Or could you put anything
I had
on?
the port in still, so I really didn't wear anything.
Okay.
You know what I mean? I didn't want anyone to see the port because that would just mean they would know I was, a cancer victim.
Right.
And I didn't want that, stigma attached.
Correct. So after the radiation, how long did you do radiation?
6 weeks.
6 weeks. Mm-hmm. And after the radiation, you were pretty much done with everything in terms of your therapies.
Yes. And then it was just the waiting game, because then you want to wait and they want to make sure there's no signs of cancer and, because you're prone to infection. There's so many things that you can have. that's so far the journey.
So I want to hear about how you're taking that forward and how you're turning things around. So I'm going to be right back to hear more from Joanne and how she really began to live life after this traumatic experience. Welcome back to It's Time for Your Health Show. I am Dr. Jeanine Cook Gerard, and I'm here interviewing Miss Joanne Gabrus, a 17-year breast cancer survivor. So Joanne, thank you so much for sharing that about the side effects of chemotherapy and radiation. If you had to, just look back at all that you went through as a cancer survivor, what would be some of your takeaways? What could you give us?
I actually learned that you need to live each day fully, because you never know when, that rug will be pulled out from under you. And I've now become very active. I joined the Oncology Society. I do a lot of speaking on breast cancer. I'm speaking about men and breast cancer also, with the stigma that's involved, because it can happen to men too. And it's become my passion. And, again, I just hope to educate, because I am an educator, and hope that I can stress the importance of taking good care of yourself.
With breast self-examination?
Yes, definitely.
How often?
You should do it every time you're in the shower. Okay?
Yes. Follow-up is so key and vital.
And know that it's treatable. I know a lot of women are scared to even, investigate, but it is a treatable disease, and we're seeing that it's now 1 in 8 women. So make sure,
1 in 8.
1 in 8,
wow.
yeah, other statistics.
So it's not what it used to be. It's not a death sentence like it used to be.
No.
People are surviving.
We are surviving, yes, definitely.
So that's huge when it comes down to understanding breast cancer and knowing that you can survive it.
Oh, for sure. I'm living proof right here.
You can survive it.
Yes.
So that's very important. And thank you for sharing your story. This is huge for us in going forward, especially on Long Island, that we know that we can survive.
Yes, definitely.
So I thank you for coming, Joanne Gabrus, and thank you for all that you have gone through and all that you can tell us now, looking back in hindsight of what you went through and how you can help others. And I know that you share your story. I didn't know that you were a breast cancer survivor until I heard you share your story in the classroom. Thank you so much for sharing it with students as an educator, because sometimes that puts the textbook or make the textbook a reality for us.
And we need to get the word out. We need to really, follow up and, take care of ourselves. That's the bottom line. So thank you for having me.
Yes, thank you for being here. This is It's Time for Your Health Show, and we are glad that you were able to join us today.